Hi, my name is Mia from UNLV. I'll be presenting the Calgary Family Assessment Model, also known as a CFAM. This is my agenda for you today. First, let's look at the key concepts of CFAM. CFAM is an integrated, multidimensional framework based on 6 theoretical foundations. So it's like a template that nurses can translate this complicated idea into real practice. Let's look at the 6 foundations so that we can understand the basic assumptions underlying this model. As you can see, one of the assumptions is that each family has their own way of communication and self-regulating system. So we need to understand and learn their language to help them to make a change. Especially these days, there's no more stereotyped family in modern society. So it is really important to discover the family pattern and system. So let's keep these 2 concepts in mind and explore CFAM in depth. Every family is a distinct unit, focused on the individual in the context of the family. Now, I will explain how to use this tool in family nursing. CFM consists of 3 categories. Structural assessment is commonly used to identify the family members and their relationships to each member. Genogram and EcoMap are most commonly used in this process. Developmental assessment focuses on the development tasks. Depending on the stage of family cycle, we can expect certain events and tasks. Functional assessment is to identify how individuals actually behave in the family. This is a diagram that shows which subcategories are under specific assessment. Nurses should be able to move back and forth on the diagram in order to draw all of the relevant information into an integrated assessment. Here are the key concepts of CFAM. Using the CFAM is to gain a snapshot of the family at a particular time point. So we do not need to collect all peripheral information. Instead, we have to decide which assessment we will perform today and ask relevant subcategory questions. Now, let's define these concepts in CFAM. Family is a group of persons who are emotionally or physically bound together and experiencing an event in a particular time. Health is a psychological, biological, even cultural perception and constantly changing. Environment is a systems and relationships that are interacting with individuals and families. Nursing is a process to help families to achieve a better outcomes. Now, let's look at how this model has been applied to family nursing. In family nursing, nurses are using this model to offer a therapeutic intervention, particularly therapeutic conversation that is collaborative and based on strength-focused relationship. Nurses are using these questions to build a positive family perception. In response, families are sharing more information. The 15-minute technique is very useful that will guide you to practice CFM in main ideas. After a successful CFM, nurses can use Calgary Family Intervention Model to develop a optimal intervention plan. However, we are not going to discuss the detail of a CFM today. CFM has a many strengths. For example, it enables nurses to do more comprehensive family assessment that includes current family strength, resources, problems, and perceived illness. One of the downsides of CFAM is, in real practice, still many nurses are finding it difficult engaging in in-depth conversation with the family. I will explain a little bit more about 15-minute family interview technique so that you can envision yourself how to use this model in real practice. It consists of 5 elements: manner, therapeutic conversation, genogram sometimes equal map, therapeutic question, and commendation. First, we have to introduce ourselves and then start a conversation. It's always good to add why you're interviewing them. For example, you can say, "Hi, my name is Mia. I'll be taking care of you today. If you're okay, I would like to invite you and your family for the interview so that we can provide the best care for you and your family." In this process, you can start to build a genogram to understand the family structure. What's important in this interview technique is nurses need to use circular questions. The main idea of circular communication is each person influences the behavior of the other. Lastly, if you observed family strength during the interview, please commend them. Families who internalize the commendations by a nurse appears more receptive and open to nurses' advice. Now, let's review 2 articles. The first article we're going to review was done in the Children's Hospital in Iceland. They evaluated the effectiveness of a therapeutic conversation in family with a child admitted for acute or chronic illness. Their intervention was a therapeutic counseling during the stay by a trained staff. After discharge, both groups of parents completed the online questionnaire. The study team developed a Likert type scale to measure the outcome. They found that a group who received the therapeutic intervention had a significantly higher score in perceived cognitive support compared to the control group. However, there was no significant difference in perceived emotional support. The second research was done in oncology hospital in Germany. Their aim was to evaluate the effectiveness of CFAM and examine its benefits. The intervention group received the family nursing from nurses who completed a family nursing program. They wanted to measure psychological burden in both patients and family and the intervention effect on family functioning. This study used the multiple instruments to capture the data, including self-developed scales. Unlike the first study we reviewed, this study team did not find any significant outcomes in psychological effect of CFAM. By reviewing these studies, I found several limitations. First, these studies used a self-developed Likert type scale, and the items they had included were very different, so we don't have enough evidence to confirm the effectiveness of CFM in the real setting. Second, health is ever-changing, so does family dynamics. Change won't be made in a day. They need to observe the family through continuous intervention. Also, a long-term effectiveness of CFM needs to be explored. Lastly, these studies lacked of explanation of how competent nurses were in leading the therapeutic conversation. Now, I would like to summarize the CFM and conclude today's presentation. Here and now approach of CFM allows the nurses to view the family's big picture so that we can make the most optimal family intervention. As a result, we can help families address their illness concerns as well as promote families' well-being. However, we need to develop a standardized tool to evaluate the effect of CFM, also need to observe its long-term effect. This is my reference. Thank you.